there are people in this community who are faced with some of the most difficult medical decisions that anybody could possibly face. And in those moments, they not only stand up for their family members or themselves, they start patient advocacy organizations, they start research organizations looking for cures.
Okay, we're here with Michael Pearlmutter. He is the CEO of EveryLife. Michael, thank you so much for joining us today.
Thank you for having me.
So Michael, your organization does so much in the rare disease community. If there were a couple things that you wanted people to know about the mission, what would those be?
So EveryLife is a policy and advocacy organization that advocates on behalf of the rare disease community. If I was going to summarize it in a few words, I would say the patient community is our North Star. So everything we do is of service to the patient community, led by the patient community. And we're really interested in building the roads and bridges around policy and regulatory work that make the science and innovation of rare diseases possible.
So your North Star are the patients that you serve. I love that concept of hope and the hope that you provide and EveryLife provides the rare disease community. What do we need to do, or what can we do to elevate and build on that hope?
Well, one of the things that we can do is have advocates speaking to their legislators, talking about the priorities of the rare disease community. Those priorities were determined by the rare disease communities. We want people to engage with the Rare Disease Caucus, so be more involved and knowledgeable on Capitol Hill. And the opportunity to meet with advocates and engage with advocates to really understand that story is really impactful. So I think one of the things we can do simply is show up, right? It's have the patient journey told by the patients, empower them really to use their stories to affect real policy change.
What is the message that you want to deliver?
I think we want the patients to really understand that the power is in their hands, right? That, I'm a rare disease patient myself. I'm a member of this community, and I'm going to go to my legislator and I'm going to tell them my story. And so I'm hoping that patients will feel really empowered to tell their story and to utilize that to affect positive change.
There's also a lot of innovation going on around and within the rare disease community. What excites you about that innovation?
I think 10 years ago, this story would have been a little bit different, but today I feel like the science and innovation is really doing its job, and it's our job to make sure that the regulatory and policy frameworks catch up to that science. We're learning about new innovations. I'm learning about them in the cell and gene therapy communities. The hope, the optimism for treatments that slow disease progression and even curative treatments are available for the broader patient population. When I joined EveryLife, I was told a statistic that just appalls me. About 5% of rare disease patients have FDA-approved treatment. And that's not what success looks like. But I'm excited by what I'm hearing out of industry, what I'm hearing out of some of these organizations like ARM, where they're talking about all of the innovation that's happening and the hope that for that other 95%, for the 28.5 million people with rare diseases in the community, as well as their families, caregivers and support networks, that there really is a path forward for them, for their children, and for the broader rare disease community.
What do you do to motivate that community? And what do they do to motivate you to come back and keep pushing?
The community that motivates me every day. I mean, there are people in this community who are faced with some of the most difficult medical decisions that anybody could possibly face. And in those moments, they not only stand up for their family members or themselves, they start patient advocacy organizations, they start research organizations looking for cures. They could solely focus on their child or their relative that has a rare disease, and yet their focus is so much broader on the entirety of the community and how can they be of service to that community. That inspires me every day. I mean, I joined EveryLife in part because I'm a rare disease patient. But what inspires me is not my rare disease story, it's everybody else's rare disease story.
Michael, the work that you do in EveryLife, it changes the world. And I think there's two things that we all need for success. We gotta love what we do. We gotta believe what we do can change the world. You guys are changing the world, so thank you for what you do every single day.
Thank you for letting me be just a small part of other people's rare disease journeys.
Thank you.